Could you explain to us what sickle cell is?
Sickle cell is a genetic blood disorder that affects the hemoglobin protein inside of the red cell. And when we look at a red cell, it has millions of hemoglobin molecules in it, and their job is to carry the oxygen that we breathe in and deliver it to all parts of the body. And that's the fuel and nourishment that we use to function. So, in a normal hemoglobin red cell, the hemoglobin molecules release the oxygen, and then while they don't have oxygen, they just remain in solution until they travel back to the lungs and pick up more. With sickle cell, then the sickle hemoglobin has a different nature. So once it releases oxygen, all of those hemoglobin molecules start to stick together, and
Mhm.
they kind of semi solid rods that distort the shape of the cell into the sickle. And because it resembles the farm tool that farmers use to cut wheat, it
Mhm.
got named sickle red cells. Now, normal red cells last 120 days in the bloodstream, but sickle cells only 19. So that creates the shortage of red cells that we call anemia. So that's what sickle cell anemia is.
Why do you feel it's so important for the Black community to donate blood in regards to sickle cell?
So when we talk about matching your blood type, a lot of people think about the major blood group types. So everybody has A,
Mhm.
B, AB, or O, and then you're H positive or negative. But there are several what we call minor blood group antigens that are more similar among people within a certain race or ethnicity. Now, if you only had to get one transfusion in your lifetime, that really doesn't matter. But with blood transfusions are really a major part of management for some individuals. And so they have to get multiple transfusions. And in fact, red blood cell transfusions can also prevent certain sickle complications like strokes or severe of pneumonia that we call acute chest syndrome. So some individuals who have had strokes or at risk for strokes have to get monthly blood transfusions. And once you've had a stroke, you need that for the rest of your life. So they come into contact with blood from different individuals to get that monthly transfusion. And some of those minor things that are different, then our body will make a protein called an antibody against it. And then if we develop multiple antibodies, it's very difficult to find a unit of blood that really matches you. So for that extended antigen matching, that's the reason it's important for African Americans to donate blood.
I'm glad you talked about the different types of blood and the antibodies and so forth. And I'm hoping that this will persuade people in the Black community for sure to donate. We need to donate more blood, y'all, for
How how big are you on donating blood?
sure.
Um, we would partner with Red Cross for not only our sickle cell patients, but when patients need what's called an exchange transfusion. So, normally, when we give a blood transfusion, we're giving that on top of what you already have. But when there are severe complications, we have to try to get those sickle cells out of your body. So, we want to uh, pretty much take out your blood volume and exchange it for a blood volume that has normal hemoglobin. So back in the day when I was training in my fellowship, we did them manually. And really, you would sit there for hours and hours and maybe push about 50 cc's of blood in and draw blood out. And you would go back and forth like that. Well,
Hmm.
that's efficient. And so there are now automated ways of doing that where a machine does it.
Okay.
So and that process only takes a couple of hours. So it's a much more efficient way of exchanging blood,
Mm.
uh, less time and effort for the patient and for staff. So the Red Cross does provide that service for us.
Okay.
We've been working with them for many years, and it's been a really positive relationship. Sometimes a stroke can happen at 2 o'clock in the morning. It might be 11 o'clock at night, and so we had a great relationship where we're able to call and say, "Hey, we need you." Or it may not be a stroke; it may be a severe form of pneumonia. Um,
Mhm.
Cells just aren't getting the oxygen to the body, and we have to do that exchange. Those are emergent situations, and outside of that we have patients who have been determined to be at risk for a stroke, and we do these exchanges to prevent the first stroke from ever happening. So
Okay.
red and instrumental in our chronic transfusion program.
I love it. And it's so amazing how technology has just changed. Like,
Yes.
oh my gosh, that's so amazing. And
Every day somebody needs blood. And during holidays, when we're likely to have more accidents and more trauma victims, the blood supply can grow short pretty fast.
yeah,
So I think certainly bringing, focus to it for Black History Month, where maybe people are paying a little bit more attention and maybe want to do something to give back to the community. And that's a perfect way to do that. Blood transfusion is really now still a mainstay of therapy for treating certain complications and preventing certain complications. So we definitely need that. But there's a lack of acceptable donors for patients. So it's not a universal cure that's available to everybody. But there are clinical trials ongoing that look promising for gene therapy, where the patient is their own donor and their cells are edited to correct the sickle gene or replace it with another gene that will not sickle,
mhm,
grow those cells in large amounts and give them back. But really, when we think about those things, they are not widely available at this point. So, again, blood transfusions are crucial to continue to provide health and hope and healing to individuals who have sickle cell. So thank you so much for doing this to get the word out, because awareness plus action is power.
yeah, we have to donate more blood for
Absolutely.
sure. And of course, for Black History Month, but all throughout the year.
That's right, all throughout the year. I like to tell I'm a pediatrician, so I treat kids with sickle cell. And, I like to tell them about the first patient diagnosed and published in the United States was a gentleman by the name of Walter No Clement Noel. And he was actually from the West Indies and came to Chicago to go to dental school and got sick, went in the hospital. And when they looked at his blood cells, they thought, wow, this is really odd. But it's encouraging to me that in spite of being hospitalized, he was able to finish dental school with his class and went back home to practice dentistry into adulthood.
Mm.
So sickle cell does not have to define you. You are still, an individual with hopes and dreams, and we want to do everything we can to help them accomplish those and have a good quality of life.
Y'all, in order for us to make a change, we have to have action associated with that awareness. So make sure you get out, everybody, and make sure that you donate blood.
This video raises questions, and I need for you to be extremely honest in the comments when answering them. And just so you know, I have 3 questions. Number 1, do you know someone with sickle cell? Number 2, what did you think sickle cell was? And number 3, did you learn anything from this video. Now, please be honest in the comments when answering these questions. Share this video with anyone you deem necessary, and don't forget to like and subscribe to the channel.